Hey, everybody. Welcome to this week's Point Counterpoint. I am Dr. Amelia Barrett, and I am here with Dr. Tanya Paynter. And today we're going to talk about a topic that affects so many people with migraines, which is adrenal fatigue. Now, what we basically mean by this comment is that your body has been under stress for so long, which I'd like to say can be a direct result of having to deal with having headaches every day, having to power
For sure.
through. Yeah, don't you think?
Yeah, absolutely.
Yeah, so many people are like, "Oh, my life's not that stressful." Dude, having headaches every day is stressful on your
So
body.
stressful. So stressful. Yes.
Yeah. So anyway, hugely common problem for people with headaches, and I feel like it's really hard to get good answers about how to treat this. What do you think, Dr. P?
Yeah, I actually literally like an hour and a half ago did this, not knowing that we were going to focus in on the adrenal stuff today, and talking about how it's so underdiagnosed in conventional approach to migraines, especially when you have symptoms like the letdown migraines, right? Where you feel okay during the day, but then as soon as you get home and you start relaxing, and the migraine hits, or it hits always on Friday and it lasts through the weekend. Those are pretty good indicators that, yeah, there's some adrenal issues going on and it needs to be looked into for sure.
Yeah. Yeah, I totally agree. I love that. And it's puzzling for the people when they're having this happen because they're like, why am I getting headaches when I actually feel good? You
That's
know?
right.
Yeah.
When I'm home
That
and
seems
kicked up
backwards.
feet. I know.
Yeah. So for those of you who are noticing that, listen up. This is for you. So basically, what's happening here is that the adrenal glands make our stress chemicals. They make noradrenaline or norepinephrine, kind of same thing, different name, and epinephrine or norepinephrine. And they also make cortisol. So the ones I was just talking about, the adrenaline, those are super fast. They don't last very long. Cortisol lasts a little bit longer in your system, but those are your stress chemicals. And when your body is under stress all day long, most days, your body essentially runs out of its ability to make those stress chemicals. That has other effects on your hormones. And short story, we can pick this up in lab testing, even simple blood tests that are covered by LabCorp and Quest. Your doc just has to order the right things. Yeah. So there are some
Mhm.
more, kind of less commonly done ways to pick it up too, through the saliva, urine tests, things like that. But I mean, this is available at literally every lab in the country. It's just that people don't test for it very often, right?
Right. Yeah.
Yeah.
I would also say that if you're going to do a test on cortisol at like a LabCorp or some other lab, doing a 24-hour urine collection is probably going to give you a better picture of your overall cortisol levels. And correct me if you disagree, Dr. Barrett, but it's going to give you a better idea of your overall cortisol levels than just a single point of blood draw, because a lot of times you'll come back normal at that single random point. But if we see a cumulative over the 24-hour period and you come back on the very low end of range or below normal, then we know, yes, there's an issue here.
Yeah, sure. It definitely gives you a better sample size. I will say though, I usually just check a morning cortisol, have people go in and get the cortisol done before 9 a.m., just because it's so similar to what we do for other blood tests. You just go in, it's a single one time thing. So I often just use that as a
Do you
screening
find
test for
do you
the
find that
cortisol.
there are actually people who come back low with a blood test?
Low or high, but I think DHEA helps a lot too. So if you do the
Mhm.
cortisol and DHEA at the same time, then you can get a sense of where people are in
Okay.
adrenal fatigue. Do you find the urine cortisol to be more helpful, or what's your go-to?
Yeah, I yeah, anytime I do have a suspicion and I do the blood draw, it always comes back in normal range. And I say, you know what, I don't care. Let's do a 24-hour urine, and it comes back low. So that's just been
Yeah,
my experience. But
yeah,
that's actually a really good point. I've never paired it with DHEA to kind of get a better sense there. So that's thanks for that tip.
yeah, yeah. So, I mean, point here is that there are lots of ways your doc can go around trying to get this diagnosis. Lots
Hmm.
of ways to get at it.
Yep.
But basically, I think of adrenal fatigue for anybody who's not sleeping a good solid 7, 8 hours a night, every night, or anybody who is having troubles with anxiety, depression. They're
Mhm.
under a lot of stress. They've had, major life events, death, divorce, illness, all the big things. Those are always things that make me think that adrenal fatigue might be part of what's going on. Are there any other symptoms you tend to look at for? thinking, oh, maybe
Yep.
adrenal fatigue is part of it?
Those are for sure, the chronic fatigue when, I hear somebody say, "Well, I it takes me 2 or 3 hours to feel like I can even function in the morning," or,
Yeah.
"I'm groggy all day long. I just don't feel well rested when I'm sleeping, and I'm tired all day long," which I think is most of people with chronic migraine.
Yeah.
But, and then also too, the timing of the migraine itself. So understanding, we should have a nice healthy spike of cortisol in the morning. If you're waking with a morning migraine, one of the first things I think of, there are several reasons it could be a first morning migraine, but one of the things I think of is you're not getting that appropriate cortisol release in the morning like you should be, and that can be a reason for not feeling good. And then also, as we'd already talked about, those letdown migraines is another big red flag for me on investigating cortisol.
Yeah. Yeah. And honestly, anybody who's just having headaches every day, if you're having headaches
Yeah.
5, 6, 7 days a week, you are probably in adrenal fatigue just as a
Yeah.
result of your body having to work that hard. So I
Good
think
point.
that, we've gone over, there are lots of different circumstances where this is something to think about. Now, once we get an idea that we're there, that this may be a part of the underlying cause of the headaches, treatment can be tricky too. And I wanted to take some time to share one of my favorite tools for it today, which is checking heart rate variability. So, heart rate variability has become very easy to measure. They're all over fitness devices. And the one I want to talk to you about today is using an Apple Watch, which does allow you to track your HRV. So, before I get into specifics, I just want to talk a little bit about how it helps you. Okay. So, heart rate variability is how much your heartbeat changes from one beat to the next, right? I think we're sort of used to thinking like if your heart beats super regularly, that's good, but you actually don't want your heart to be a metronome, right? You want it to be responsive to the world around you. You want both parts of your nervous system to be in balance. And heart rate variability is a measure of how much imbalance, how much parasympathetic you have. So, in short, what we see is that people who are in adrenal fatigue have a very low heart rate variability, and people who aren't have a higher heart rate variability. So, a higher heart rate variability is normal. That means your heart rate is more variable from beat to beat. It's more responsive to what your body's going through, the demands of your day, etc. So, that's really what we're looking for. So, heart rate variability naturally decreases as you age. So, if you're using some kind of a fitness tracker, you always want to make sure that you have your own data plugged in so that it's giving you age adjusted norms for HRV. Like, I don't want to be comparing myself to like a 20-year-old, we're going to have very different heart rate variability norms. So, just
It
make
is never a
sure
good idea to compare
it's
yourself to a
never, yes,
20-year-old.
just a general life thing. It's not a good idea. That's funny. Okay. So, when we're trying to treat heart rate variability, I think that a lot of the advice out there is like, eat right, get some good sleep, take care of yourself. But, like, how do you know if it's working? It's so frustrating. Like, we're all trying to take care of ourselves, for the most part. So, I think it's nice to have some objective data about the impact of what you do and how it changes your heart rate variability. So, we know that things like meditation, deep breathing, yoga, or other exercise can be very powerful ways to change heart rate variability. Of those three techniques, breath work is probably the strongest. There's the most scientific research to support that. But how do you know when you sit down to do a breath work session if you've done it right or not? I'm going to show you that. So, if you have an Apple Watch, all you do is press your button to go to your menu. Oh, Siri wants to talk. Siri, we're not talking to you. There we go. And you go to mindfulness. Okay. Hit the mindfulness button and then see where it says breathe. Hit the breathe button and then it will check your heart rate variability. Now, you can program your watch to check your HRV for like 1 minute or 5 minutes or whatever you want to do. Just know that you have to hold still during that time. So, like if you want to check it after you do yoga or something, make sure it's when you're lying down at the end. Don't expect it to give you a good read while you're moving. You really have to be still. So, what you do is check where you are at the beginning of your session, and then you repeat it again at the end of your session. And you just see, hey, did I push my HRV up? If you did it right. That's awesome. And as we all know, things like breath work are essentially the same as lifting weights. When you lift weights over and over again, you get bigger muscles. When you do breath work over and over again, you eventually shift your nervous system into healing, into parasympathetic. So that's what we're doing with that. I just think that for me, maybe I just like the pat on the back, like, oh, yay, you did it right. Or wait, something went wrong. Go back to the drawing board. I really need that feedback because I don't want to meditate for 3 months and find that nothing has shifted and I've wasted all that time. So that's why I think it's so helpful to get that sort of objective read on how you just changed your body. And I've got several ways for people to learn more about how to treat adrenal fatigue. My favorite of which is the retreat I have coming up in February. It's going to be right outside of Puerto Vallarta, and we have an entire week at this incredible retreat center that will very much be about treating adrenal fatigue, reducing stress, and restoring. It's really going to be a week of healing. So we'll start every day with meditation classes, then we'll go to breakfast, and then we'll have poolside lectures about things like heart rate variability. I'm going to teach everybody how to use the device I use in my courses to help people combat adrenal fatigue. And then we'll do a little bit of gentle yoga. You have afternoons to rest or get a massage or go to the private beach. So this place is amazing. Or the pool, the infinity pool overlooking the ocean. And then
Sounds
we'll
so
meet
nice.
up again for some restorative yoga in the evening before dinner. And, it should be a super cool group of people who are very much about, taking control of their health, making these headaches get better. They are not willing to let this stand in the way of them getting the life they want. These are people who really want to dive in. They want to learn the new science and technology that can help them heal. And I think, even for me as an MD, I recognize that most of this is outside of conventional neurology. These are not tools that most doctors are bringing to their patients. Just because, partly because it's not pharma based, and that's kind of where medicine is now. I got nothing against pharma, but for many people, they need an answer other than that. So these are the sort of resources that people need to have in order to really move the needle on their headaches. So for those of you who want to really launch your journey to headache wellness and have some time to heal and also to learn some valuable new information that will seriously change your life, this is something you may want to look at. I've got the link around the video for you. So you can check that out, email, reach out if you've got any questions about the retreat. I only get to take 10 people, so it's probably going to fill up pretty fast. So don't wait too long. All right. Thanks. Okay, well, thanks everybody for joining us today to learn some new tools to empower you to reduce your headaches. Have a good week. We will see you next week.